Good morning. It's another beautiful day. These are some tomatoes that I planted in my backyard. I just kind of threw the seeds and look at it. I have tomatoes growing. You can also plant these things in pots. And here's some spinach. This is what we call callaloo in Jamaica. This is spinach. See how nice and green it is. And here I'm holding a cup with lemon. I've cut a lemon in half and squeeze it into this water, and every morning I have that, 16 ounces of water with lemon juice in it, and I just drop the lemon in there because the rind will infuse into the water also, and that's also very, very healthy. This lemon water gets the bowel going, and it really neutralizes the blood. Tons of vitamin C in this, and it's a good way to start your day. Not with coffee, but with some plain water, or water with apple cider vinegar in it, or water with lemon slices or lime juice or slices. I want to tell you a story this morning, and my stories are intended to help us, you and I, to become healthy and to stay healthy through nutrition and lifestyle. So I was in a hospital some years ago, maybe about 4 years ago, and I heard two physicians, they were young men, two physicians talking. And one of them said to the other one, "You know, I'm feeling so sad today." And he said, "Why?" He said, "Because two of my young patients were just diagnosed with pancreatic cancer." And the other one, he stopped doing what he was doing, and he said to him, "How old are these patients?" And he said they're both in their mid-40s. Now, pancreatic cancer diagnosis is never a good one. I mean, no cancer diagnosis is good, really. But usually, when one is diagnosed with pancreatic cancer, one has about 6 months to a year to live. So this guy was not happy. His peer said to him, what is the common denominator with these two men? And he said, well, they are both African American men, and they're both diabetic, and I have them on diabetic pills. I believe he said metformin, but he did say, I have them on diabetic pills. So that's the common denominator. They're African American and they're diabetic, and I have them on diabetic pills. So the other physician said to him, well, that's the reason. That's the cause of the pancreatic cancer, the diabetic pills. I stopped doing what I was doing completely just to listen to these guys talking, because I'm a nurse of 20-something years, but I was never aware that diabetic pills have side effects or effects of potentially causing cancer. So I started doing some research. Thank God for internet. I went on the internet and I started researching diabetes pills or diabetes drugs leading to cancer. And there was a lot of information online about these diabetic pills leading to bladder cancer specifically. But since I know that the body is one whole, the bladder is not just a little piece. The bladder is connected to the bowel, is connected to the heart, is connected to the brain. Everything is interconnected. And the blood is one blood that flows from one organ, one tissue, one cell to the other. then if one can get bladder cancer from diabetes drugs, one can get any cancer from diabetes drugs. That's the conclusion I came to. And in my research, I found that these diabetic drugs, including insulin, can potentially cause various kind of cancers. Wow. One thing I do know is that diabetes is reversible. Even if one has type 1 diabetes, where one is on insulin, diabetes can be reversed. Any disease of the body can be reversed with proper nutrition and proper lifestyle. Nutrition is number one. Moderate exercise, decreased stress level, and getting adequate sleep. I think those are the key. I have a niece who was a brittle diabetic. Brittle, I mean, she was in and out of the hospital. Even when she was pregnant, she was like teetering between life and death. Okay, because her physicians told her she was high risk if she got pregnant because of the brittle diabetic that she is. And finally, this young lady changed her eating habit, went on an exercise program, and she was not even overweight actually, but just changing her eating and went on an exercise program and has been able to get off all diabetes drugs, including insulin, and her blood sugar has been stable 100% of the time. I believe I also told a story of a friend who was on Januva. That's a diabetic pill, which, by the way, I did some research and I saw that one of the risk factors with Januva or Janumet, they're in the same category, Actos, is bladder cancer. And my friend was on Janumet or Januva plus insulin, and ever since she changed her lifestyle, changed the way she eats, started an exercise program, she told me that in the first 2 weeks she shed 12 pounds just by changing the way she eats and starting an exercise program. And since then, her physician has stopped the Janumet and decreasing the insulin. She's lost a significant amount of weight. When you're overweight and you're fat, you cannot be healthy. And my friend was overweight, fat, okay? We like to butter up things and sugarcoat things. She was fat, okay? And since she's lost the weight, her doctor is decreasing her diabetes drugs, and I'm convinced if she stays on this healthy pathway, they will be able to take her off diabetes drugs completely. Okay, so diabetes is curable, diabetes is reversible with proper nutrition and exercise, adequate sleep, and a decreased stress level. And I wanted to share those stories with you today. Now, we should be eating primarily a plant-based diet. Minimal amount of meat, including minimal amount of fish and seafood. Minimal amount of meat. Minimal amount of eggs. Minimal amount of dairy, cheese, milk. You either minimum, better yet, none. Occasionally, yes, for a special occasion, but meats and flesh and dairy and sugar should not be part of our daily diet. Heart disease can be reversed with proper nutrition and moderate exercise. I believe I told you about my other family member who was on many, many pills, 20 to 30 pills a day. And ever since, his children have him on a good, and then he's not starving. Smaller portions and different quality of food. The doctors have taken him off most pills. I believe he's only on 3 right now. They have him on a cholesterol pill, which is not good for you. A cholesterol pill, a blood thinner, Plavix, and 5 milligrams of Norvasc. Okay, so you can cure, you can heal yourself, you can reverse diseases with proper nutrition, primarily plant-based. Fruits, vegetables, nuts, and good grains. No white rice, no white bread, no cookies, no crackers, no chips, no Cheetos, no sodas, no so-called juice. Okay, lots and lots of vegetables. Every day you should be having a nice big salad. Okay, and lots of green vegetables and fruits. Nuts are very good for you. Walnuts, almond nuts, pecan nuts. They're very good for you. And water, of course. Okay, so take care of yourself. Remember, your health is your biggest wealth. Food is your medicine, and medicine is your food. And also remember that walking is man's best medicine. Take care of yourself. You have one life to live. Live it well. And stay away from the junk food. Take care. God bless you till we meet again.